Hello. My name is Jones, and today we are going to look at a group of antibiotics known as aminoglycosides. Aminoglycosides are antibacterial drugs that have an amino group attached to a glycoside. Aminoglycosides have bactericidal activity, that is bactericidal activity against gram-negative aerobic bacteria. This is achieved through binding to the 30S and 50S ribosomal proteins, leading to misleading of the genetic code and inhibition of translocation. Aminoglycosides are polar drugs, that is, with a poor gastrointestinal absorption, so intravenous or intramuscular is recommended. Some examples of aminoglycosides may include amikamycin, gentamicin, neomycin, streptomycin, tobramycin, and neomycin. So you can see from the examples that I've picked here that most of them end with the acin or mycin. So these are some of the examples of aminoglycosides. Some of the uses of aminoglycosides include treatment for Pseudomonas aeruginosa lung infection, treatment of otitis externa, treatment of superficial eye infections, treatment of tuberculosis. When we talk of streptomycin, it is used in tuberculosis. Treatment of bacteremia, septicemia, or respiratory tract infections like also skin and soft tissue injuries. Can also be used in burns, wounds, and peri-operative infection that are caused by susceptible strains that can be sensitive to this same drug. So some side effects of aminoglycosides that we can quickly point out here is that they can damage the inner ear, result in trouble in maintaining balance. They can bring about hearing loss. They can bring about kidney damage, and also they can affect muscles, bringing about skeletal muscle paralysis. Then to do with pregnancy, these aminoglycosides are looked at or categorized as pregnancy category D. This is because aminoglycosides should be considered potentially ototoxic and nephrotoxic to the fetus. If these drugs are used, for instance, that is in pregnancy, or if the patient becomes pregnant whilst on treatment with aminoglycoside, the patient should be educated about the potential harm that may result that is affecting the fetus. Gentamicin, of course, is the preferred choice during pregnancy, as there has been more documented experience of it being used in pregnancy without major side effects or notable side effects. So to do with breastfeeding, because the drug can be excreted through human milk or through breastfeeding, so the mother also needs to be educated about this, the drug can also be passed through breast milk and bring about the known side effects of aminoglycosides. So if you want to remember the types of aminoglycosides, you can use my mnemonic, that is TANGS, like tongues. That is what I necessarily use to remember some types of some type of aminoglycosides that are there. So in the tangs, that is TANGS, there we are looking at tobramycin, amikamycin for A, N neomycin, G gentamicin, then S streptomycin. Okay, so if you want to remember the use of the drug or mode of action of the drug, you can using the term amino. Okay, from the term amino, I remember A like against. Okay, then A, this same A we're saying against aerobic. So aerobic, you know, there's N in amino. So against aerobic gram negatives. So aminoglycosides work against aerobic gram negative. Then I try to remember for the aim to say it's mainly bactericidal. Okay, so aminoglycosides